Good afternoon, I'm Shawnee Yao, and this is One News Now. The country's top diplomat refuses to disclose the official behind the thwarted procurement deal with Pfizer. But one senator says he knows who dropped the ball. Man Los Baños with a report.
Senator Panfilo Lacson asked Foreign Affairs Secretary Teodoro Locsin Jr. about the foiled vaccine deal with Pfizer and BioNTech during the confirmation hearing of DFA officials earlier today.
Who dropped the ball?
In an earlier tweet, Locsin said someone has dropped the ball that put in peril the planned procurement of some 10 million Pfizer shots for as early as January 2021. According to him, the doses through our envoy to the U.S. Jose Babes Romualdez were supposed to arrive by January next year. But the DFA chief refused to disclose any name.
It's enough that I really lost my temper because Babes and I really work very hard and we don't like to see our efforts wasted, but never mind.
Nevertheless, Lacson said he already knows the official who messed up. In a text message sent to One News, the lawmaker explicitly stated that it was a cabinet official. He added that this person wasted the coordination efforts carried out by Locsin and Romualdez. Lacson went on to describe him as someone who keeps on dropping the ball but stays in the game as the coach refuses to replace him. Health Secretary Francisco Duque III denied that an official made a mistake that stalled the procurement of Pfizer vaccines. Duque notes that the Health Department, for its part, studied the deal to make sure that it will not be disadvantageous to the government.
First of all, there is no such a thing as dropping of the ball because if you look at the statement, the negotiations are ongoing, So tuloy-tuloy po ito.
According to Duque, vaccine czar Carlito Galvez Jr. has in fact signed an agreement with the U.S. pharmaceutical company. In his briefing today, Palace spokesman Harry Roque said he had no idea about who Locsin was referring to. Nevertheless, the official denied the government failed to act early on securing supplies from Pfizer, citing as proof Locsin's negotiations with U.S. Secretary of State Mike Pompeo. Reporting for News 5, Mean Los Baños, we are One News.
The Health Department logged more than 1,100 new COVID cases today, bringing the total caseload to over 492,000. Of that number, some 24,800 are still considered active. Davao City recorded the most new cases with 126, followed by Quezon City and Rizal. 21 people died of the disease overnight, pushing the death toll to around 8,800. On the flip side, 400 new recoveries were reported today, pushing the total tally of those recovered to more than 419,000. In an effort to prevent a spike in cases, authorities are now issuing warnings to individuals who are caught not wearing face shields in public. The IATF has ordered the mandatory use of both face masks and face shields outside residences starting Wednesday. Officials are also reminding the public that full face shields and not just eye visors must be worn at all times. Earlier, an ophthalmologist warned that this could lead to eye fatigue or eye strain. Despite this, the Philippine Eye Research Institute Director, Dr. Leo Cobillan, believes that what's more important is the lessening of the risk of contracting COVID-19.
So nakikita natin when you wear a face shield, napiprevent mo yung pag-spread, no? Because the capacity of the aerosols to spread, malaki yun eh. So, napiprevent natin by wearing face mask at saka face shield.
We're going to pause for a quick break, but we will be back with more stories after that. Keep it here on One News. You are still watching One News Now. I'm Sean Yao. The Education Department says that over 1,000 schools have been nominated for the pilot run of face-to-face classes next month. The initial list does not include learning institutions here in Metro Manila, which is still currently under GCQ. Education Secretary Leonor Briones says the schools have been chosen by regional offices. Aside from the recommendation, she says other important factors will be taken into account.
Now, una, may mga kondisyones tayo, in addition of course to the vaccine. Una, kailangang may pahintulot ang local governments. Pangalawa, kailangan din ang consent ng mga parents.
Undersecretary Nepomuceno Malaluan has also clarified that in-person classes will still be under the blended learning program. According to Malaluan, the size and schedule of physical learning sessions will be reduced during the dry run.
Ito po ay blended pa rin sa distance learning at kaya ginagawa ito sa sinasamahan natin ng face-to-face ay para ma-complement ng mga bagay na maaring gawin sa face-to-face sa loob ng paaralan.
The city government of Valenzuela has lifted the business permit suspension of NLEX. Let's get the details from Camille Samonte, who joins us live from Mindanao Avenue. Hi, Camille. What's the situation now at the toll plazas? Is there an easing of traffic?
Sean, the toll holiday along NLEX has been put to an end following the lifting of its business permit suspension. This means toll collection within the borders of Valenzuela City are now in place. The Valenzuela LGU and the NLEX Corporation agreed to lift the barriers along RFID lanes from 5 a.m. to 10 p.m. Toll fees will also be collected during the said time period. Barriers will be removed but will be brought back along the RFID lanes for safety purposes. Both parties have agreed to reinstate cash lanes at strategic locations at various toll plazas in Valenzuela. Mayor Rex Gatchalian warns that the permit of NLEX will be suspended again if it fails to comply with the stated conditions. The expressway operator vows to improve its RFID system, including the readability of sensors, by January 30, 2021. Recall that Gatchalian earlier ordered the suspension of the permit of NLEX over its supposed failure to address traffic issues. Sean, the Valenzuela LGU and the NLEX Corporation will also create a technical working group to come up with innovative solutions to the issue. Sean?
All right, thanks for that update, Camille Samonte, reporting to us live from along Mindanao Avenue. And the Philippines will likely prioritize COVID-19 vaccines from China's Sinovac, even if some critics have time and again raised concerns over its safety and efficacy. One infectious disease expert said that vaccine hesitancy among Filipinos is normal but will change once sufficient data is available. JC Cosico with the story.
During the Vaccine Statistics Summit on Wednesday, vaccine czar Carlito Galvez Jr. presented the country's priority COVID-19 shots based on the ranking of experts. Topping the list of 17 vaccine developers is China's Sinovac. Russia's Gamaleya is at number 8, followed by AstraZeneca at number 9, while Pfizer and Moderna from the United States placed 13th and 14th respectively. Galvez has earlier said that the government is hoping to seal the deal with Sinovac this week to supply the Philippines with 25 million doses by March 2021. Recall that public health expert Dr. Tony Liachon has flagged the government's choice of Sinovac over supposed lack of safety and efficacy data. A resource person present in the summit has also confirmed that Sinovac has yet to release its Stage 3 trial results.
There has been no public release of any of the details of the phase 3 trial results, which is the data that we need to be able to understand whether the candidates are efficacious.
In defense of Sinovac, Galvez says the firm has already secured the approval of the Vaccine Expert Panel or VEP. He adds that it was even granted a limited emergency use authorization by China back in July. The official assures the public that China will act on the result of Sinovac's phase 3 clinical trials in a few weeks. In an interview with One News The Chiefs, National Task Force Against COVID-19 Special Advisor Dr. Ted Herbosa says the VEP studied several parameters before coming up with the ranking.
In expert panel, nakita ko parang mga 10 yung factors na aral nila. So yun ang hindi alam ni Dr. Leachon na merong body of experts, people of experts who have rated this, studied all the clinical material, the science, and then evaluate.
For her part, Philippine Foundation for Vaccination Executive Director Dr. Lulu Bravo says there is always a risk on procuring vaccines.
Just so the vaccine development would have to be facilitated and fast-tracked. But I assure you that no country would want to use a vaccine that has not been proven to be safe and effective. That's all there is to it. But there is always going to be a risk.
The Health Department once again assures Filipinos that all vaccine candidates will undergo strict regulatory processes to ensure safety and efficacy.
Meron tayong nakatakdang proseso at dapat sundin yan, respetuhin natin ang Department of Science and Technology, yung kanila pong Vaccine Expert Panel. Sila po ang sumusuri ng lahat ng scientific evidence, no? Para patunayan na itong mga bakuna ay ligtas, de kalidad at epektibo, at kayang i-implement o kayang ipatupad.
For News 5, JC Cosico, we are One News.
Filipino healthcare workers in the United States were among the first to receive Pfizer's COVID-19 vaccine as the country started its mass inoculation. Marian Enriquez tells us their experiences.
Filipino ICU nurse Darius Remutige is among the first healthcare workers in the United States to receive Pfizer's COVID-19 vaccine. The 48-year-old worker says he feels lucky to be vaccinated this early.
They only have like about 250 vials, I think. So, of course, I have a mom that's 70-year-old, so I want to protect her. So I don't want her to get anything after I get off work.
Darius has been working at the ICU cardiovascular unit of the University Medical Center in Las Vegas, Nevada for 26 years. He says he has not experienced anything like the COVID-19 pandemic in his whole life.
Nurses are getting sick in our unit. They've been positive, so they're pretty much not able to work. So, I mean, it's tough in the hospital right now, especially in critical care. So, I mean, to the point that, we have to work extra to cover our unit.
Emergency nurse Marshall Reyes, also a Filipino, is set to be vaccinated this week.
California, uunahin yung ER nurses, ICU nurses, and yung mga pasyente sa nursing home. Ako ER ako, so I'm assuming mauuna ako magkaroon. At saka yung mga nurses na nag-aalaga ng mga pasyenteng may chronic diseases like dialysis.
Marshall contracted COVID in March and was confined in the hospital for a month. He says the experience took a toll not only on his physical well-being, but also on his mental health.
Mahirap yung pinagdaanan namin. Hindi namin kasi pati yung pamilya ko meron, di ba? Nagkaroon din. Every time nagigising ka sa umaga, kinakabahan ka, papasok ka, kinakabahan ka, mamaya magkaroon na naman ako ng COVID.
Marshall is hoping that vaccines will be readily available soon so that all of his colleagues and family members will finally have access to the shots. For News 5, Marian Enriquez, we are One News.
Hundreds of Catholic faithful physically attended this year's first Simbang Gabi at the Quiapo Church. Earlier today, the church reached its maximum capacity of 300, prompting a number of devotees to stay outside the minor basilica. Local police and church officials enforced mandatory wearing of face masks and face shields, as well as physical distancing. In an interview with 1PH's Sa Totoo Lang, Interior Undersecretary Jonathan Malaya said minors are now allowed in churches. He explained that they will be lenient in implementing age restrictions so long as minimum health protocols are observed.
Pinagbibigyan na natin kasi yung mga bata naman, every once in a while, kailangan naman nila na makakuha ng fresh air. So, pag sa simba, hindi na po tayo nag-iigpit.
For more updates, visit News 5, the Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. I'm Shawn Yao. We are One News.